Hello, my name is Dr. Alice Chapman. I am a public health adjunct faculty here at SNHU, and I'm also a veterinarian by training, and I began my career as a clinical veterinarian in small animal practice. But I always had a really strong interest in public health, and so I transitioned to a career in public health and served in the United States Air Force as a public health officer for more than 20 years. Now I focus on teaching public health and epidemiology to undergraduate students and to veterinary medical students. So this is a great question because a typical day in public health, a typical day as a public health officer in the Air Force usually turned out to be anything but typical. So for a little context, being a public health officer on a military base is very similar to being the director of a local health department. My team and I were responsible for the health of the base community, and that would include the active duty military, their families, and other people working on the installation. So our focus was on ensuring that all of the things that they are exposed to in a typical day are such that they will be able to stay safe and healthy to be able to do their jobs. So our focus, for example, was on inspecting restaurants to ensure that they were following proper food safety practices, because the impact of making a lot of people sick could be very serious. We also closely monitored the prevalence or the occurrence of disease in the population so that we could notice if there were any changes, any increases, so that we could then promptly investigate those instances and if necessary, investigate a confirmed outbreak of disease. We also inspected workplaces to make sure that people who are working with hazardous chemicals or loud noise or other things, they would be protected and still be able to do their job. And I worked with lots of people who were not necessarily in the medical field, did not have a medical background. So being able to communicate public health concepts in everyday language was really essential. And on any given day, and frankly, this is what I love about public health, is that we never really knew what was going to pop up. And so you could be faced with any new public health concern that pops up. And so being flexible and being adaptable are really crucial skills to develop. One of the major things is to remember that public health is based in science, and so taking the time to really learn the basic science of public health, which is epidemiology. Now, some students might get a little bit intimidated by the math involved in that, and yeah, there's a little bit of math, but getting a firm grasp on those concepts early is really critical, because that's what's going to make you much more effective when you are faced with an uncertain situation. So no one's forgotten about the pandemic, right? It only happened a few years ago. But if you might recall, in its early stages, all we knew was there was this virus. It was a coronavirus. Well, we know something about coronaviruses. And so the first actions that were taken were based on what we already knew about coronaviruses in general. But as the pandemic unfolded, we learned more by monitoring what was going on, and we were able to then we had to change some of our strategies because the virus was different. And so that kind of comes to the second part of what is really important in public health, is that you have to remain curious and you have to remain alert and be ready to adapt all this knowledge and skills that you've gained to a new situation, because every situation is going to be a little bit different. So not being afraid to be curious and ask questions and apply what you know to an unknown situation. And you'd be surprised how much you can figure out just by applying what you already know to a new situation.